Okay, let's unpack this. When you picture really dangerous jobs in the U.S., what jumps out? Maybe like high-rise construction, logging.
Commercial fishing often comes up.
Right, exactly. But what if I told you some of the most, well, perilous workplaces might be somewhere you'd least expect, inside our hospitals.
Hmm.
So today, we're doing a deep dive right into the heart of healthcare. Specifically, we're looking at on-the-job injuries among VA nurses.
Yeah, and our goal here really is to equip you with some critical knowledge, you know, about protecting these healthcare heroes who care for our veterans.
Absolutely.
We'll explore the true scale of the problem, what kinds of injuries VA nurses often face, and maybe most importantly, those absolutely crucial steps for recovery and support, especially if you're in Missouri.
So you'll walk away understanding the unique challenges, definitely, and the resources available if they get injured doing this vital work.
Exactly. Helping our nation's heroes.
And talking about surprising facts, here's a statistic that honestly, it really jumped out at me right away. Hospitals are, and this is no exaggeration, among the most dangerous workplaces in the whole country.
It's kind of shocking when you first hear it, isn't it?
It really is. They average about 6.8 work-related injuries per 100 full-time workers. Now, think about that. That's nearly double the rate for private industry overall.
Double. Yeah, that's an incredible figure.
It's astonishing.
It really is. And what that points to, I think, is just how pervasive this issue is, especially when you consider the sheer scale within the VA system itself.
Right.
I mean, you've got roughly 93,000 nursing personnel in VA hospitals across the nation. So that national average, it translates into thousands, literally thousands of staff injuries every year just within the VA.
Wow. So it's not some minor issue, it's fundamental.
It's a fundamental part of the job for way too many nurses, unfortunately.
And it seems to often concentrate in one particular area, doesn't it? Like musculoskeletal injuries.
Oh, absolutely. You could almost call it an epidemic. National surveys show nurses suffer more than 35,000 back and musculoskeletal injuries on the job every single year.
35,000.
And these are injuries severe enough to make them miss work. And look at this, almost half, nearly 50% of all injuries reported by nurses and nursing assistants, they're musculoskeletal disorders,
Yeah.
sprains, back strains, that sort of thing.
That's just staggering, the cumulative toll that must take.
It is. Now, to be fair, the VA has made some significant investments in safety, things like their Safe Patient Handling program.
I've heard about that.
Yeah, and it was pretty effective, actually. It cut nursing staff back injuries by an impressive 45% between 2009 and 2017.
That's a big drop.
It is a big drop. But what those numbers also show, even with those best efforts, is that the inherent physical demands of patient care, they don't just go away. These injuries aren't always accidents in the traditional sense.
More like a predictable consequence.
Sort of, yeah. A predictable consequence of the work itself, which really highlights this ongoing need for, constantly evolving safety protocols.
Yeah.
The challenge is still there, even with good intentions.
And let's bring this closer to home for our listeners in Missouri. The local reality really drives it home. St. Louis County and the city together. Nearly 6,000 healthcare injury incidents in a recent year.
6,000.
And Jackson County, that's the Kansas City area, recorded over 1,800. Those are the highest totals in the state.
Oh.
So it just underscores that VA nurses right here in these areas, they face the exact same national risks, high patient loads, physically demanding work. It's a constant local thing.
So, yeah, understanding that scale, the really critical question becomes, what kinds of injuries are these nurses actually dealing with day to day?
Exactly. Now that we get the scope, let's zero in on the what. What injuries are they facing? And number one, probably not surprising, is musculoskeletal strains and back injuries.
Right. The lifting, the transferring.
Precisely. All that frequent heavy lifting, transferring patients, repositioning them, it puts immense strain on a nurse's back, neck, shoulders, knees, you name it.
Yeah.
And this often leads to painful sprains, chronic strains, sometimes herniated discs, or, really debilitating joint injuries. Just imagine repeatedly lifting veterans day after day. Over time, that's not just one incident, it builds up.
It becomes chronic back pain or a serious shoulder tear.
Exactly.
And what's really key there, I think, is that it's often not just one big lick that does it. It's the cumulative trauma.
Right, the repetition.
Yeah, the repetitive nature of these tasks, day
Yeah.
in, day out. It just wears on the body. It's like tiny little micro injuries adding up until, bam, one routine movement suddenly becomes the breaking point.
That makes sense. And then, of course, you've got the very common Slips, trips, and falls.
Always a risk in a busy environment.
For sure. Busy wards, clinics, they're unfortunately kind of ripe with hazards. Think about, spilled fluids, maybe a stray cord from equipment, even just uneven flooring sometimes.
Hmm.
It's not unusual at all for VA hospital staff to slip on a wet floor or trip over some piece of equipment, and that can cause wrist fractures, ankle or knee sprains, even serious head injuries.
Yeah, you can imagine.
Imagine a nurse rushing to an emergency call, down a slick hallway. That split second could lead to a fall that changes their whole career.
That really speaks to the high-pressure nature of the hospital setting, doesn't it? The need for speed in emergencies, combined with those inherent hazards.
Right.
It means you have to be constantly vigilant, but sometimes even that's just not enough to prevent these things.
And then you also have punctures, cuts, and hazardous exposures.
Needlesticks.
Exactly. Nurses work daily with needles, sharp instruments, potentially dangerous substances. So yeah, they can get needle stick injuries, cuts, puncture wounds.
And face exposure to bloodborne pathogens or chemicals, too.
Right. An accidental needle jab or maybe contact with blood from a contagious patient that puts a nurse at serious risk of infection.
And these exposures, importantly, they're treated as work-related illnesses.
Good point. Not just injuries.
Correct. And they absolutely must be reported promptly, just like a physical injury, because quick action is so key to preventing, further complications down the line.
That's critical because it's not just about immediate treatment for their health, right? It's also about that documentation.
Absolutely vital. You need incredibly thorough and accurate documentation to make sure it's recorded as a work-related incident that can be just crucial for any future care or compensation claims.
Okay. Now, unfortunately, there's another stark reality for nurses, especially in those high-stress environments, and that's workplace violence.
Yeah, sadly, that's becoming more recognized as a hazard.
Nurses sometimes encounter patients who are agitated or confused, or maybe even visitors who can become aggressive. And VA nurses have been injured by patients. I mean, being struck, bitten, even knocked down, leading to bruises, cuts, lacerations, even concussions.
It's a terrible thing to face.
It is. And the threat of violence, while maybe often not talked about enough, it's a very real occupational hazard in healthcare, particularly maybe in mental health units or busy ER settings.
It really highlights that a nurse's job involves managing not just the medical side, but also human behavior, which, like you said, adds this significant, often unpredictable layer of risk to what they do every day.
Yeah. It's a part of the role many people outside the profession probably don't fully appreciate.
Agreed.
And finally, we need to talk about the often invisible injuries, stress, and mental health conditions.
Right. The psychological toll.
The VA environment, it can be incredibly high pressure. You're caring for veterans who might be severely injured or ill, dealing with life and death situations constantly. It's profoundly taxing.
Understandably so.
And over time, some nurses develop what are called occupational stress injuries. Things like anxiety, depression, even PTSD, stemming from traumatic events or just chronic overwork.
Burnout and compassion fatigue are also really prevalent, aren't they?
Very much so. And while it's not a visible injury, like, say, a broken bone, this kind of psychological harm from the job is recognized. And it can be compensable if it's shown to be directly caused by workplace factors.
And the crucial thing there, I think, is that these invisible injuries, they might be harder to measure than a sprained ankle, but they often have a much more pervasive long-term impact on a nurse's life, their career, their whole well-being.
That's a really important point.
Now, the VA and the unions, they do try to mitigate the physical risks, through training, safety protocols like those no-lift policies, using ceiling lifts and other tech.
Which can help with the physical strain, definitely.
Right. They can make a big difference there. But the mental and emotional toll, that's a huge ongoing concern. And it needs just as much, if not more, attention and really tailored support.
So given all these risks, physical and mental, the critical question has to be, what are the immediate steps? What does an injured nurse need to do right away to protect themselves, protect their rights after something happens?
Yeah, immediate action is just vital. It protects their health and their legal standing.
Okay, so what's step one?
Step one, and you really can't overstate this, report the incident immediately. You need to tell your supervisor right away about the injury.
Like as soon as it happens?
Ideally, yes. As soon as it happens, or as soon as you realize a condition might be work-related, maybe something developed over time.
Okay.
Reporting it kicks off the official incident report process. And even if it seems minor at first, report it anyway.
Why is that?
because it ensures the event is documented. That's absolutely essential if symptoms get worse later on.
Hmm.
And it's also crucial for your eligibility for certain benefits down the road.
Okay, so immediate reporting. Got it. What's next? Paperwork.
Paperwork, yes. As a federal employee, you must file an official claim form. It's under the Federal Employees Compensation Act, or FECA.
FECA. Okay.
Now, there are two main forms. If it was a sudden traumatic injury like a fall or a lifting accident, you complete Form CA1. That's the Federal Employees Notice of Traumatic Injury, and you do that as soon as possible.
CA1 for sudden injuries. What about the ones that develop over time, like repetitive stress?
Right. For those or for illnesses like an infection exposure, you use Form CA2. That's for occupational diseases.
Okay, CA1 or CA2, depending on the type. Where do you send it?
You submit that form to your facility's HR department or their workers' comp coordinator.
Yeah.
And there's a time frame for the CA1. You need to get it in within 30 days to preserve certain benefits, like continuation of pay.
30 days. That's important.
Very important. The VA then forwards your claim to the Department of Labor's Office of Workers' Compensation Programs.
Yeah.
OWCP for short.
OWCP. Heard that acronym before.
Yeah, you'll hear it a lot. They'll issue you a unique claim number, and here's a really critical piece of advice. Always keep a copy of everything you file.
Good tip. Paper trail.
That paper trail is your absolute best friend in this process.
Okay, reported it, filed the form. What about getting medical help?
Crucial. Seek prompt medical treatment. Get the right care for your injury right away. If it's an emergency, obviously head to the ER.
Right.
Otherwise, here's a really important right you have as a federal employee.
Mm.
You get to choose your treating physician for a work injury.
Oh, really? You're not stuck with the VA employee health clinic?
Nope. You have the right to choose. And honestly, it's often beneficial to see a doctor who actually understands the federal workers' comp procedures, the OWCP system.
That makes sense. They'd know the paperwork.
Exactly.
Right.
And when you get treatment, make sure you tell the provider this is a work-related injury, so they know to bill OWCP, or maybe your agency directly using something called a CA16 authorization form instead of billing your personal health insurance.
Okay, tell the doctor it's work-related.
Yes. Because that immediate treatment, it doesn't just help you recover, it creates that vital medical documentation linking the injury directly to your work.
Documentation again? Seems key.
It's everything.
Yeah.
And building on that, you need to be proactive. Document and preserve all the evidence you can.
Like what kind of evidence?
Well, as you're filing your claim, gather anything that supports what happened. Write down all the details of the incident while it's fresh in your mind. If anyone saw it happen, get their names, maybe a statement if they're willing.
Witness statements, okay?
Save copies of the official accident report, any safety emails that might be relevant, maybe even photos of the hazard if you can safely take them.
Photos, good idea.
And importantly, talk to your chosen doctor. Ask them to write a detailed medical report that explains precisely how the work incident caused the injury they diagnosed.
Ah, making that causal link explicit.
Exactly. Strong medical evidence that clearly connects the dots. That is often the deciding factor in getting a claim approved. So, thorough medical records are absolutely essential.
Okay, so you've reported, filed, seen a doctor, gathered evidence. Is that it?
Not quite. Filing the initial claim is really just the beginning of the process. You have to follow up on your OWCP claim.
Follow up how?
Well, OWCP might send you letters asking for more information. Or sometimes they might initially deny the claim, maybe because the documentation was incomplete or the medical evidence wasn't strong enough.
Oh, so a denial isn't necessarily the end of the road.
Definitely not. Don't get discouraged by an initial denial. Many claims are initially turned down because of paperwork issues, missing forms, things like that, and they can often be approved on appeal.
Okay, so persistence pays off.
Persistence is absolutely key. Make sure you respond to any letters from OWCP by their deadlines. And honestly, it's often a really good idea to consult resources. Talk to your union rep, or maybe find a federal workers' comp expert or advocate if you hit roadblocks.
Because it's complicated.
Federal employee claims can be quite complex, yes. Having someone knowledgeable guide you can make a huge difference in securing your benefits.
Hey, you mentioned continuation of pay earlier. COP.
Yes, COP-E.
Oh, yeah.
That's important too. VA employees might be eligible for continuation of pay for up to 45 days after a traumatic injury, provided that CA1 form was filed within 30 days.
And that means?
It means you continue to receive your regular pay while OWCP is processing your claim. It provides some financial stability during that initial period.
That's a big help, I imagine.
It really is. So the big takeaway from all these steps, Early reporting and proper, thorough paperwork are just incredibly important. They create that clear record linking the injury to your job, and they activate the benefits you're entitled to, like paid leave and medical coverage.
Okay, so with all that complexity, the forms, the deadlines, OWCP, the medical evidence, finding the right kind of support seems absolutely critical.
It really is.
And for federal employees, especially VA nurses, maybe in the Kansas City or St. Louis area, that often means looking for clinics that really specialize in this stuff, like Restore Muscle and Joint.
Yes, exactly. Restore Muscle and Joint, which is part of the Federal Injury Centers Network. They have a clinic right there in Kansas City. And they've really carved out a unique niche. They specialize in treating work-related injuries specifically for federal employees.
Ah, so they know the system.
They know the system inside and out. Their team offers this really comprehensive approach. They help injured VA staff not just with the tricky OWCP claims process, but also with the specialized rehab care that these kinds of injuries often need.
So if an injured nurse goes to them, what kind of help can they expect with that OWCP claim process itself? The paperwork side.
Yeah, that's a great question because navigating all that federal paperwork can feel totally overwhelming, right?
For sure.
Restore's staff, they are genuine experts in the OWCP process. From day one, they give you step-by-step guidance on filing the claim. They make sure all the necessary forms, the CA1, the CA2, those CA17 duty status reports your doctor fills out, are completed correctly and submitted on time.
Okay, they handle the forms.
They help you handle them, yes.
Mm.
And they really focus on educating you, the injured worker, about your rights, helping you understand things like, yes, you can choose your own doctor, or here's how you claim wage loss compensation if you can't work.
That education piece sounds important.
It is, because that specialized knowledge helps nurses avoid those common mistakes that so often lead to initial claim denials. A lot of denials happen just because of incomplete forms or not having the right kind of medical evidence attached.
Okay, so they help with the claim. What about the actual medical treatment for those common injuries like back strains, shoulder tears? How is their approach different there?
Well, Restore Muscle and Joint provides really top-notch medical care, but it's specifically tailored to the injuries common among VA nurses and other federal workers. Their team includes orthopedists, chiropractors, physical therapists, all folks who really understand conditions like chronic back strain, herniated discs, torn rotator cuffs, knee injuries.
Well, they see these injuries a lot.
All the time. They'll do a thorough evaluation,
Mm.
arrange any needed imaging x-rays, MRIs, and then create a personalized treatment plan just for you.
What might that involve?
It could involve targeted physical therapy, maybe therapeutic injections to manage pain and inflammation, bracing, or even referring you for surgery if that's necessary. But crucially, because they focus on federal work injuries, Restore's doctors also make sure all your treatment is meticulously documented for OWCP.
Ah, documentation again. Tailored for the system.
Exactly. They tailor the care to your specific job demands and your health needs, but always with an eye on what OWCP requires for documentation.
So they're not just treating the injury, they're treating it and building the case for the OWCP claim at the same time. That sounds like a huge advantage over just going to any doctor.
It absolutely is. Honestly, one of the biggest advantages of using an OWCP-savvy clinic like Restore is that the medical reports they create are genuinely claim-ready.
Claim-ready.
Yeah. Restore's physicians know exactly how to write those detailed narrative reports that OWCP demands. They explicitly link your diagnosis back to the specific workplace incident or exposure. They clearly detail any work limitations you have because of the injury.
They connect the dots, basically.
They connect the dots perfectly in the paperwork. This provides really robust medical documentation that gives your claim the absolute best chance of getting approved. And, if for some reason an OWCP claim is initially denied, Restore Muscle and Joint, being part of federal injury centers, can also help with the appeals process. They can help gather opinions from specialists or get additional evidence needed to challenge and hopefully overturn that denial. They really act as your advocate through the whole thing.
Wow, that is comprehensive support, especially, like you said, with their local presence there in KC.
It is. Restore Muscle and Joint is kind of uniquely positioned in that Missouri-Kansas region. They're part of the only full-service provider network focused specifically on DLO and WCP cases in Kansas City and St. Louis.
So they fill a real gap.
They fill a huge gap because, frankly, not many other doctors want to deal with federal workers' comp cases. They find the paperwork too burdensome. But Restore's team, they have extensive experience with agencies like the VA, but also the Postal Service, TSA, lots of federal agencies.
So they get the challenges federal employees face.
They really do. They even work with union representatives sometimes, if needed, and they understand how critical it is to communicate properly with your employer about work limitations or accommodations.
And being local means easier access to that specialized care.
Exactly. Specialized care close to home. And importantly, Restore offers free initial consultations, which is a great way for any injured federal worker to just understand their options and rights with no commitment up front.
So it really does sound like they combine that expert medical treatment with deep claims know-how. They handle the healing and that often scary paperwork. It's about restoring more than just muscles and joints, isn't it? It's peace of mind, too.
Precisely. As their team often says, we're dedicated to your health and successful recovery. If you've been injured on the job, don't go it alone. Let us help ensure you receive the care, benefits, and support you deserve.
Okay, so let's just quickly recap this deep dive then. We've really explored the significant job hazards VA nurses face, those surprisingly high injury rates, and the common types of injuries they deal with. Everything from those debilitating physical strains and falls.
To needle stick exposures, the sad reality of workplace violence, and even those often unseen mental health conditions like stress and PTSD.
Right. And we laid out those vital first steps to take right after an injury, emphasizing immediate reporting, getting the FACO paperwork right, and seeking prompt, appropriate medical care from someone who understands the system.
And we highlighted the kind of specialized support available through organizations like Restore Muscle and Joint, which can be invaluable for navigating that complex federal workers' comp world.
It's just crucial, I think, for you listening to understand these details, whether you are a VA nurse or maybe you work elsewhere in healthcare, or maybe you just care deeply about the well-being of the people who tirelessly serve our veterans.
Absolutely. These folks deserve our support.
So thinking about all this, given the essential role VA nurses play and these shockingly high injury rates that persist, here's something maybe to mull over. What broader societal shifts, or maybe resource allocations, might actually be necessary to ensure these dedicated caregivers get not just adequate but truly exceptional preventative safety measures and recovery support?
That's a big question. How can we as a society best advocate for the people who care for our nation's heroes?
Something to think about.